Next drug is prednisone. This is synthetic corticosteroids. This class of drugs mimics the actions of endogenous glucocorticoids. Such actions include vasoconstriction, induction of apoptosis of lymphocytes, the stimulation of hepatic gluconeogenesis and protein catabolism, the inhibition of prostaglandin and leukotriene formation through inhibition of phospholipase A2, and the stimulation of gastric acid and pepsin production. Glucocorticoids are used in the treatment of adrenocortical insufficiency, allergic reactions, collagen vascular disorders, for example, SLE, RA, polymyositis, inflammatory bowel disease, ITP, arthritis, multiple sclerosis, asthma, nephrotic syndrome, and spinal cord compression. Other uses include the diagnosis of Cushing syndrome, stimulation of fetal lung maturity, treatment of leukemia and lymphoma, part of several chemotherapeutic regimens, and immunosuppression in organ transplants. Side effects are symptoms of Cushing syndrome, osteoporosis, hypertension, increased susceptibility to infection, hyperglycemia, fat redistribution. Next drug is bupropion. Bupropion acts to inhibit reuptake of norepinephrine and dopamine. It also affects nicotinic antagonist, result in reduction of dopaminergic mesolimbic signaling. Used to treat depression and attention deficit hyperactivity disorder, also used as a smoking cessation agent. Side effects are psychosis, increased risk of seizures in patients suffering from anorexia or bulimia, suicidal ideation, hypertension. Next drug is Pravastatin, one of from class of statins. It inhibit HMG-CoA reductase so decrease cholesterol biosynthesis, and it is also increase in the concentration of LDL receptors used in treatment of elevated cholesterol levels. Side effects are myopathy, abnormal liver function tests, and it is also teratogen. Next drug is Citalopram, which is selective serotonin reuptake inhibitors, SSRIs. The SSRIs act to prevent the reuptake of serotonin from the synaptic cleft, thereby potentiating the effects of serotonin on the postsynaptic receptors. The SSRIs are used to treat major depression, anxiety disorders, obsessive-compulsive disorder, eating disorders, motor recovery after stroke, and premenstrual dysmorphic disorder. The side effects are sexual dysfunction, decreased libido, difficulty with orgasm, drowsiness, weight gain. There is some evidence that SSRIs may increase suicidal ideation among adolescents. Next drug is dextromethorphan, opioid class. Work by binding to specific opioid receptors result in activation of these receptors results in the hyperpolarization and decreased activity of neural cells. This opioid is primarily used for cough suppression, act by suppress the cough reflex in the brainstem. Side effects are cardiac and respiratory depression, constipation, meiosis, nausea, urinary retention. Next drug is ibuprofen, a non-selective NSAIDs class. Ibuprofen is a reversible inhibitor of cyclooxygenase 1 and cyclooxygenase 2. Inhibition of COX-1 and COX-2 reduces the conversion of arachidonic acid to prostaglandin precursors, resulting in decreased prostaglandin synthesis. There are many uses for ibuprofen, including use as an antipyretic, an analgesic, and an anti-inflammatory, including the treatment of rheumatoid arthritis and osteoarthritis. Side effects are GI bleeding, allergic reactions, interstitial nephritis, tinnitus, hepatitis. Next drug is Carvedilol. Carvedilol is an alpha-1 receptor blocker as well as beta receptor blocker. Used to treat hypertension. Carvedilol, specifically, is also used in the treatment of chronic congestive heart failure in addition to ACE inhibitors and diuretics. Side effects are dizziness, hypotension, bradycardia. Next drug is Trazodone. Trazodone inhibits reuptake of serotonin and also blocks 5-HT, alpha-1, and H1 receptors. Trazodone is used to treat insomnia and major depressive disorder, rare occurrences of priapism, sexual dysfunction, sedation, headache, nausea, QT prolongation, hypotension. Next drug is fluoxetine, which is selective serotonin reuptake inhibitors, SSRIs. The SSRIs act to prevent the reuptake of serotonin from the synaptic cleft, thereby potentiating the effects of serotonin on the postsynaptic receptors. The SSRIs are used to treat major depression, anxiety disorders, obsessive-compulsive disorder, eating disorders, motor recovery after stroke, and premenstrual dysmorphic disorder. The side effects are sexual dysfunction, decreased libido, difficulty with orgasm, drowsiness, weight gain. There is some evidence that SSRIs may increase suicidal ideation among adolescents. Next and last drug is Tramadol. The mechanism of action of Tramadol is not completely understood, believed to act as a very weak mu-opioid receptor agonist. Used to treat moderate to moderately severe chronic pain. Side effects are GI upset, respiratory depression, seizures. Tramadol has been reported to decrease seizure threshold, suicidal tendencies, serotonin syndrome. Okay guys. That's it for third part. Thanks for watching, and as always don't forget to subscribe.